right, today we will be demonstrating an oral facial examination on Karen. Karen's date of birth is 1/28/1959 and she is 60 years old. So we are going to begin by examining the structure and function of your facial muscles. So we start off very simply. You just relax your face and we're going to have a look. You can show the camera what's going on. There does not appear to be any drooping on either side of the mouth. It's very symmetrical, so that is great. I have already sanitized my hands, by the way, but we'll go ahead and put the gloves on as well. The eyelids are both open normally. They're symmetrical in their ability to open. The jaw appears level as well, no asymmetry on that. And there's not any involuntary movement going on. We don't have any twitching, spasms, anything like that. And you're comfortably breathing through your nose, so that is great. Now we're going to move on and have you do a few things. That way we can observe the movement and the symmetry of the movement. First, we're going to have you smile for me. Great, look at the camera. Looks great, nice and symmetrical, no deviation to either side. Now we're going to have you open your mouth nice and wide. Oh, it looks great. Now, the jaw is not deviating to either side, so that's good. Indicates you're not having any problems with your TMJ joint at this time. I can't say the same for myself. Can you raise both of your eyebrows? Great, also symmetrical and well within your control. And finally, we'll have you close your eyes tightly. And I'm still working on these gloves here. All right, and that looks excellent as well. So we're going to move on from the facial muscles and zoom in to your lips. So again, if we look at your mouth, there doesn't appear to be any drooping at either corner. It's nice and normal. It looks like your lips are of a normal size. There's plenty of tissue there. While at rest, your lips are able to rest in a closing position, so that is good. You're able to breathe through your nose, so you're not breathing through your mouth, you're not drooling. And the lip tissue itself is pink. It looks like there's plenty of blood flow and that it is healthy. It doesn't appear that you've had any kind of cleft lips, and there's no scar tissue that I can see on your lips at this point. So everything visually is looking good. Let's move on again to the function now of the lips. I'm going to have you smile again. It looks great, still nice and symmetrical. There's no deviation. Now I'm going to have you pucker. Again, nice and symmetrical. There's no deviation in your pucker. Now I'm going to have you alternate between the pucker and the smile a few times. That looks great. So you're getting the entire range of motion necessary there, and it's well within your control. So now I'm going to have you take a deep breath and puff out your cheeks, and we'll hold your breath for 5 seconds. So 1, 2, 3, 4, 5, and release. Very well done. And we're going to do the same thing, and make sure you don't exhale at all during this process. So inhale, puff your cheeks out. Great, so there's no air escaping through your nose, and you can relax. So that's all that we were checking there. And now I'm going to have you say ooh-ee, ooh-ee a few times for me, okay?
Ooh-ee, ooh-ee, ooh-ee.
Great. So that looks really good. It looks like you have a full range of motion necessary to make those sounds within your lips. So we're going to move on from the lips, and we're moving internally towards the tongue. So first we're just going to do a visual analysis and observation of the tongue. So go ahead and open your mouth. Okay, it looks like we have good color. Nothing is discolored. It looks nice and healthy. It does appear to be a normal size for your mouth, so that's excellent as well. Doesn't look like there's any sign of scar tissue, any atrophy, or anything unusual going on that's outside of your control. Well, let's look one more time. Again, looks very good. So now we'll have you do a few things with your tongue. So I'm going to have you stick your tongue out as far as possible. Great, nice and far. Now, can you go ahead and hold it out for 5 seconds? 1, 2, 3, 4, 5. Excellent. And now I want you to stick your tongue out again. Bring it to this side, bring it up. Oh, what a show off. Go so far and bring it down. All right, great range of motion in all those directions. Was any of that uncomfortable or difficult? No, great. Great, and now I'm going to have you retract your tongue in the mouth. Let's see what's going on there. Looks good. It looks like the frenulum is a nice length, or frenulum, that's a more accurate pronunciation of that, and it allows for the full range of motion you need, so that's good. Now I'm going to watch you say la la la.
La la la, la la la, la la la.
Okay, looks good. Now we're going to move on to ka ka ka.
Ka ka ka, ka ka ka.
Okay, and finally, we are done with the tongue. Now we're going to move on to the hard palate. So that's the front part of the roof of your mouth. So I'm going to go ahead and do a visual observation first. Doesn't appear to have any discoloring. There is no scar tissue. Appears to be a normal size, normal vaulting. We don't have any surgical evidence or anything like that there, and there are no prostheses at this point. So everything visually is looking great to me. Now we can move on to the soft palate, so just a bit farther back within your mouth. So first, again, I'll observe the color. It looks good, nice and consistent with the hard palate on you. Now I'll go ahead and observe your uvula. So I'm going to depress your tongue. Go ahead and say ah.
Ah.
Okay, looks good. Looks nice and normal. Again, it doesn't appear that you had any kind of surgery there. There's no fissures, no tears, no scar tissue going on. It looks like there hasn't been any surgery in that region. We don't have any prostheses in that area. Again, it looks symmetrical, and it looks like it was able to lift properly. So now, would you go ahead and just talk a bit for me so I can hear how you speak?
Well, it was an exciting morning. I got a phone call regarding a golden retriever, and for me that's really exciting because I think it'd be fun to add a large dog to the household.
That's exciting. All right, that sounded good. It didn't appear there was too much nasality or not enough nasality in your speaking. It was there when it was appropriate. So that's great. Your plosive consonants appeared to have good pressure behind them. And you weren't doing any strange substitutions. I was able to understand you well, so that's great. Now I'm going to have you do a prolonged ah sound for me, and I'm going to watch the back of your mouth, the soft palate. Right. Can I go E? And all again? Okay, good. It looks like the soft palate is lifting well. And I'm going to have you do a few sounds in isolation, and I'm going to see if any air is coming out of your nose. So I'm going to have you go papa.
Papa, papa, papa.
And dada.
Da, 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 da,
And
da.
puppy.
Puppy.
Looks
Puppy.
good. I don't see any air coming out of the nose, and it shouldn't be on the sounds, so that's great. Now we can move on into an examination of your teeth and a few other structures. So first, I'm going to just do a visual examination again. Okay, go ahead and open your mouth for me. You don't appear to be missing any teeth. We do have a couple of crowns, but nothing too irregular is going on. Dental hygiene appears appropriate. We don't have any dentures. We don't have any braces. Now I'm going to have you bite down gently. And I'm just going to look and see what is going on. Bite down again. All right, your bite appears to have good alignment. Everything is looking fine there. And again, healthy looking teeth. So finally, before we go, we're going to have you say some words quickly. And we're going to see what speed you can do them at. Let me go ahead and pull up a timer. And we are going to do each of these sounds for 10 seconds. So the first is just pa 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 pa. Actually, let's do 7 seconds on each of them, okay? 7 seconds each. And begin. And stop. Very good. Now we're going to do the same thing on ta. And you may begin. And you could stop. That was a couple of seconds extra. And then we're going to go into ka. And you may begin.
Good.
That was a little slower, a little trickier. All right, and this one's we're moving on to fa, fa, fa. So with an F sound. And you can begin. Oh, very fast. And you can stop. Very good. And now we'll do la. And you can begin. And stop. That was very good. And finally, this one's a little trickier. It's pataka. So the vowel's the same for everything. We're just changing the consonants. Pataka. And begin.
Pataka, 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 put together.
Okay, and that's
Put
good.
together.
All right, great. That one's a little harder because you have to think about the different sounds. But everything appears to be normal with your oral facial exam. Thank you so much for participating, Karen.
It was my pleasure.